Pediatric medical coding requires specialized knowledge of age-specific CPT codes for preventive visits. Diagnosis labs use ICD-10 CM codes are required for laboratory services to establish medical necessity, with common codes including screening, Z codes, abnormal findings, R codes, and specific disease management. Medical laboratory coding involves translating diagnostic tests, such as blood tests, urinalysis, and pathology. Neurology medical coding translates complex nervous system diagnoses, ICD-10-CM, and procedures, CPT, such as EEGs, EMGs, and nerve conduction studies, into standardized codes for reimbursement. Medical coding for wounds requires selecting ICD-10-CM codes based on type, acute versus chronic, depth and location, and CPT codes based on debridement depth or size. Medical coding for abortion and miscarriage involves distinguishing between spontaneous abortions, miscarriages, and induced abortions, with coding largely determined by gestational age, completion status, and method, surgical or medical. ICD-10-CM codes for wound disruptions, dehiscence, are primarily found in the T81.3 category, covering the breakdown of surgical closures. ICD-10 code Z48.81 is a billable, specific code used for encounter for surgical aftercare following surgery on the skin and subcutaneous tissue. It is used when a patient returns for post-operative care related specifically to skin, subcutaneous tissue, or mucous membrane procedures. CD10-CM codes for ulcers are divided into pressure ulcers, L89, and non-pressure chronic ulcer, L97, L98, based on etiology, site, severity, staging, and laterality. Podiatry medical coding involves specialized CPT and ICD-10 codes for foot and ankle care, focusing on nail debridement, callus removal, and surgical procedures like hammer toe correction. Cardiovascular coding involves using CPT codes for procedures like catheterizations, echocardiography, and stent placements, alongside ICD-10-CM codes for diagnoses like hypertension and AFib. Medical coding for ultrasound uses CPT codes to identify anatomical regions and procedures, requiring accurate documentation of images, a final report, and medical necessity. The primary ICD-10-CM code category for asthma is J45, which covers various types and severities. Medical coding for radiology requires identifying the exact procedure, views, contrast usage, and documentation of the physician's interpretation. Cardiovascular surgery coding requires precise documentation of the surgical approach, vessels treated, and grafts used. ICD-10-CM codes support medical necessity. Medical coding for mental health focuses on capturing behavioral health diagnoses and therapeutic services, like psychotherapy, assessments, and crisis intervention. Medical coding for allergies involves specific identification of the allergen, type of reaction, and distinct reporting of antigen preparation and injection services, often requiring modifiers 25 or 59 to avoid denials. And please remember that creating content, especially detailed medical coding cheat sheets, takes far more time and effort than most people realize. When we use tools like ChatGPT to help generate structured content, it doesn't mean the work is instant or effortless. Every cheat sheet still requires review, accuracy checks, formatting, and design. There is a significant amount of information that has to be condensed into a single visual, which is why smaller text is sometimes unavoidable. We hope you found these helpful.